Welcome, everybody. My name is Craig Cohen. I'm a professor of obstetrics and gynecology at the University of California, San Francisco. I'm also the director of the GloCal Health Fellowship, and I've had that honor and responsibility since its inception 13 years ago, I believe. So we've been around for a while. Really glad to have you joining this call as we're approaching our application deadline of November 1st for this year for the program starting in July. I have a PowerPoint presentation to kind of go give you an overview of the program. And then we have one of our recent graduates of the program who's also going to be giving a talk as well about his experience of being a GloCal Health Fellow in Tanzania. All right, so I'm going to shift over to share screen. So GloCal is part of the University of California Global Health Initiative. And for those of you who don't know, UCGHI is an institute that was started also about 15 years ago and represents all 10 University of California campuses throughout the state, as well as our domestic and international partners with the mandates around research, education, and community service as well. So, as you know, the GloCal Health Fellowship is funded by the National Institutes of Health through the Fogarty International Center. It was started in 2012. We're one of 7 consortia now that exist. The program now is called Launching Future Global Health Leaders in Global Health, or LAUNCH. So you'll hear that name used oftentimes. This program's been around for over 20 years, actually, even precedes the current way the program is designed. Through our first 12 cohorts, we've had the pleasure of supporting 179 fellows through this program. For leadership, I don't know if any of our other multiple PIs are on the call. If you are, welcome. So we have 4 central campuses, University of California, that comprise GloCal, although we are open and working with all 10 of our campuses, as well as the international partners. So Natasha Martin is the PI at UC San Diego. Beatrice Martinez Lopez is at UC Davis, and Sungjae Lee is at UCLA. And you can reach out to any of these individuals. Their contacts are on the website, and depending on who your primary UC, where you're based, if you're from the University of California, or if you're planning to work with a specific mentor, depending on where his, her, or their campus is located, you may want to reach out to one of the 4 of us, as well as to Kimberly Bale. So the various components of the program are quite straightforward. It's a 1-year fellowship, meant to be a 1-year fellowship. And the primary focus is to develop a research project, which you develop with your team of mentors. This is to last between 9 and 12 months in either your country, or if you're from the US, in your host country. This is really meant to be a hands-on experience, develop relationships, both scientific and personal relationships, and at the institution where you'll be working, and with the research team you'll be working with. Mentorship is also a very central component. I mentioned a team of mentors. I'll be coming back to this element in a moment. What this comprises, we have a global health education component with courses, any course which you find that are available. We have a series of online courses that are available through the University of California, one or more of our campuses. And then we have a very important career development component where you get to interact with leaders across various different types of work in global health, including academia, industry, and the nonprofit world. We have this is a new element of the program for the current iteration of launch, as it was noticed that many of our trainees from our international partners would be in the program, but had not had the time to establish meaningful relationships with their U.S. mentors. So in order to overcome that challenge, this was added, where it will be expected that if you're an international fellow, you would spend at least 1 and up to 3 months at your UC campus where your primary mentor resides. In some cases, we've had fellows who have co-mentors at more than one campus. So it's possible to split your time, for example, like Santa Barbara and Davis, or San Francisco and LA, depending where your mentors are. And we've really been having a wonderful time hosting our fellows. I just met with one of our fellows yesterday from Zimbabwe. He's going to be leaving Thursday after 6 weeks here working in bioinformatics. This is also a new element of the program. We're just in our second year of this element. So we noticed that many of our fellows would also like to, in addition to being a GloCal fellow and graduating from the program, and finishing components, would also like to have a certificate to show for their effort. And so working with Will Lescano, who's a professor at Universidad Peruana Cayetano Heredia in Lima, Peru, we worked with them to develop a certificate, and these are the various components. This is open to all of our fellows now. We initially started it, that would be for international fellows and our medical students, but it's also open for our US fellows. So it includes the online design and clinical research course, which is taught in the summer, 8 sessions, didactic global health, which is led by global health researchers from around the world. Interestingly, we've pulled together, our fellows are from around the world, and so are the people who are leading these seminars. So we have many of our site PIs from our international partners are leading various sessions. And then it's also the work, again, really to encourage you to work with your mentors and mentorship team. That needs to get documented. Those are the 3 components for a global health certificate from Cayetano. Our partners, I assume if you're on this call, you pretty much know either where you're from or where you would like to go. If you're a US fellow, we have many, many partners in Africa, and then East and Southern Asia, as well as Latin America. In the first iteration of this program, we were able to work with Mexico, but in Chile and Brazil, but countries that are part of the G20 then got excluded from this program. That's across all 7 of the consortia. We have in some of the countries, like in Uganda, and Peru, we have more than a single partner. But even if you're planning on working in a remote area of a country where maybe the institution where you are affiliated with doesn't have presence, we still are able to work with you, and we can give you some advice on how to put together your application so that it's strong and you're able to do that. As long as you're able to get the support, administrative support and mentorship that you need, you're able to work anywhere in any of these countries. So for eligibility, excuse me, we essentially have 3 categories. So one is any US postdoc fellow. This includes people who are either in residency. We've had a number of surgical residents from the various UC campuses. Often they're afforded 2 years or required to have 2 years of research. They'll use one of those years to be a GloCal fellow. It can also be after residency or during a postdoctoral fellowship, more traditional, funded maybe perhaps by a T32 or even a clinical subspecialty where you spend one of those years. And we can work with the directors of your fellowship programs if you're already in a fellowship or plan to be in a fellowship next year. And then we have postdoctoral fellows from our participating countries. So that's the 17 countries I just showed you the list of. Again, you have to have a mentor from the GloCal, the primary GloCal institution for Kenya, for example. It's a Kenya Medical Research Institute, but we've had some fellows apply who are affiliated with the University of Nairobi. They need to have a mentor at KEMRI. They also can have a co-mentor at their institution, University of Nairobi, for example, and then at one of the UC campuses. We also take a number of senior professional students. Again, this includes MD, dental students, PharmD, veterinary medicine, et cetera. And then advanced doctoral students. We've had a number of doctoral students use this to fund their dissertation research. This is after you've done your prelims and working on your dissertation, working with your mentorship team to develop a project that could be funded by GloCal. If you're an advanced doctoral or senior professional student, you need to come from one of our 10 UC campuses. If you're a US postdoc, we can recruit you in from any institution, so you don't already have to have an affiliation with the University of California. In fact, I have a fellow I'm mentoring right now who finished his PhD in nutrition at Purdue and is now working in Kenya with me and our colleagues in Kenya. So GloCal prides itself in being extremely interdisciplinary. This is just a list of some of the disciplines that fellows have come from. And within medicine, of course, it gets splintered out into all the specialties and subspecialties as well. And we've had, for example, we had a pharmacist. This is in the early iteration of the program. I like telling this story. So we had one of our fellows who's a postdoc in pharmacology, molecular pharmacology, doing scuba diving off the coast of Panama in order to identify new cyanobacteria, to identify new drugs to treat cancer. So, and we've had people work, we've also, not our program, we've had people who are lawyers actually in this program, looking at the intersection of law, policy, and various health issues related to HIV. We've also had agriculturalists, soil microbiologists in the program. As long as there's a human health connection to your area of research and area of interest, any discipline can fit. So I'm just going to take a sip for some, it's quite early in my time. As far as the selection process, after you've submitted your application, needs to be complete with letters of support, which includes letters of support from your primary US or UC mentor, as well as from your host institution or your institution if you're from that institution itself internationally. And then there's an initial review. We have a steering committee comprised of over 40 leading faculty across the University of California and our global health partners. So you may be reviewed, if you're from Kenya, you may be reviewed by a reviewer from Peru, for example, and then 2 from the University of California. We try to match based on disciplinary interest and some on geography as well. After those initial reviews of your written application are submitted, we then, the executive committee decides on like a cut. Usually we end up interviewing about half or a bit more than half of the applicants. We usually get around 40 applications. We usually end up interviewing about half or a little more than half of those applicants based on their raw scores. And then after that, we do panel interviews. I think we're one of only 2 of the consortia that actually do interviews, but we feel it's extremely valuable, especially now with Zoom. We started doing this before there was Zoom. It's made it much easier for us to do these panel interviews. This is comprised of our steering committee members and at least one of our executive committee members, which is comprised of the 4 multiple PIs I showed you earlier. And then we have one representative from Africa, who's Professor Elizabeth Bakusi from KEMRI, from Asia, Tony Raj from St. John's Research Institute, and Dr. Willie Lascano from Cayetano representing Latin America. And then this leadership group that I just mentioned to you will then, based on this additional scores from your interview, then we'll look at other factors such as diversity of disciplines, campus representation, funding priorities, which I'll come back to in a moment, geographical location, so forth. And then we'll work very closely with Kimberly and the administrative team to come up with a budget allocation. And then we make decisions, and the decision is accept with our core. So we have core funding and non-core funding, and I'll get back to that. So accept with core funding, wait list, and then not accept or reject. And then we'll give you back those comments if you're in the reject group. And there's simple comments back. As far as the funding, we get core funding. We're able to fund about 7 to 8 individuals. This year, we're funding 17 or 18 people. So I'll get back to how we're able to do that. So if you're on the wait list, that's actually not a bad thing. We're able to fund many of the individuals who are on, especially the top part of our wait list, depending on their funding priorities. So this gets to the funding priorities. This probably alphabet soup over here doesn't mean a lot, or some of you know a few. Kimberly and I have gotten to know most of these. So the NIH is comprised of 31 relatively independent institutes, centers, and offices. So the first one, for example, is NCI, National Cancer Institute. Next one is National Eye Institute, National Heart, Lung, and Blood Institute, and National Institutes of Aging, and so forth. I won't go through all of these. If you have any questions, I don't know, are we going to, yeah, anyway, you can look on our website. On the website, it actually mentions the various institutes that have funded us. What happens is, after you apply, and if we put you either in the funded or in the waitlist group, we compile your application, and then we do our best to try to match your research focus with the research focus for one or more of these institutes and offices. And then we send that packet to Fogarty National Center to our program officer, Anja Hayes, Dr. Anja Hayes, who's been wonderful to work with, who then goes to her colleagues across the NIH to see if there's potentially a match. And oftentimes there is, depending on your area of research interest. And really, when they do end up funding you, they're really demonstrating that they want to invest in you, and that can become eventually, even after GloCal, a long-term commitment. So here's just some stories of a few of our past fellows in the field. So Huan Dong was a medical student at UCLA and Charles Drew University in Los Angeles. He studied antibiotic resistance and non-pathogenic bacteria, worked in Vietnam. He's now a pediatric infectious disease fellow at UCLA. Well, we've had him, we have different speaking opportunities through GloCal from the CUGH conference, and also we have our orientation in DC, and Wang Dong has, and also UC Global Health Day, which is coming up as well. And he's been able to present it, I think UC Global Health Day, if I remember. Kendra Beard was a doctoral student at UC Davis, looking at the understanding associations between infection, inflammation, iron status in infants, working in Kenya. She's now a senior research fellow, Natural Resource Institute at the University of Greenwich in the UK. Lauren Hack was a US postdoc at UCSF, looking at school home program for youth with attention and behavioral concerns, working in Mexico. She's now an associate professor in the Department of Psychiatry here at UCSF. Hendry Sawe was a postdoc from Muhimbili University of Health and Allied Sciences in Tanzania. He's an emergency medicine physician, so he was looking at emergency care for acute episodes of illness within major chronic disease. He's now an associate professor and the head of his department, and he also hosted, and he's also the GloCal PI for Tanzania. And he and his colleagues just hosted a wonderful regional workshop at MUHAS in May this past year for all 7 consortia. And I had the pleasure of being there and joining with him and his colleagues, and all of our current and relatively recent past fellows as well in the East Africa region. Larissa Otero was a postdoc from Peru working at Cayetano, looking at preventing TB in children. She's an assistant professor at Cayetano, and she was the first K43, for those of you who don't know, is a mentored research grant from the NIH, from Fogarty International Center. And it's a 5-year grant. It's very prestigious, and she was the first recipient in all of Latin America. And she's now supporting GloCal. She's mentored other trainees that have come after her, and then she helps support us with selection process. Chemtai Mungo, a long-term mentee of mine, now is very independent, was a US postdoc. She was on the traineeship on AIDS prevention studies, T32 grant at UCSF, and then in the middle of that spent spent most of her time in Kenya. And she was looking at preventing cervical cancer among women living with HIV. She's now assistant professor in OBGYN at UNC and has been receiving lots of accolades and lots of new funding, including NIH funding, foundation support. She is definitely well on her way to becoming an independent researcher with making real impact on the lives of women living with HIV at risk of cervical cancer. So mentorship is really the central pillar that this program is built upon, and it's really based on the relationships that you already have or will develop with your mentorship team. We encourage everyone to have, again, a primary mentor from their host institution, from from their UC campus, either where they're at or in their field. And then we also believe in having a trans mentor. This could be someone who supports you professionally, a senior person. It could also be someone who has expertise in an area that you're trying to develop expertise in, for example, perhaps bioinformatics. So you need a biostatistician with that skill, or perhaps modeling, or perhaps it's a lab-based skill or a clinical skill that you need to develop expertise in. That would be the role for the trans mentor. Again, I've already mentioned the requirements for the mentor. If you have any questions, again, you can look on the website. You can also reach out to Kimberly. And then we have high expectations. We expect you to be meeting at least every month, if not more often, twice a week. Sometimes I'm meeting with my mentees on a weekly basis in the earlier phases when they're developing their protocol, getting IRB submission, getting their study off the ground. And at other times it spaces out to every 3 to 4 weeks once everything's moving quite well. For people that I mentor, most have worked in Kenya, not all, also South Africa. And I have gone to visit and work with them in the fields, and then also have them come here eventually. If they're from Kenya, for example, they'll come here and spend 1 to 3 months. So tips for a successful application: work with your mentors. Hopefully you all have solid drafts by now, and make sure you are going to be on time to submit all of your components. We're about a month away. We do have a list of successful applications on that are available to you. If you have questions, you also can reach out. Again, if you're primarily connected with your mentors at UCLA and you want to reach out to Dr. Jay Lee, you can reach out to him as well. If you have any questions about your research or your application, I've been fielding a lot of questions. I've been even also having 30-minute Zoom meetings with individuals who are either interested to apply or are applying, to give them some feedback. Reach out, use your resources, use us as your resources. I enjoy meeting with people who are interested to apply. And I know that all of the MPIs do. Kimberly works tirelessly as well, giving advice, connecting people. Use us as your resources. Just very briefly, we are 7 independent programs consortia, but we work very closely together. We have what I've called my favorite work week of the year is the orientation that happens on the NIH campus. It's usually the second week of July. And it's just really fun to be able to meet the fellows, not just from GloCal, although that's my favorite part, but to meet the many of the applicants, or not the fellows from the other programs. Also, I get to meet my colleagues, and you get to meet the leaders from across all the consortia partners, as well as from the NIH. Many of the different directors or team leads are coming. And again, they want to meet you. They want to know who they're investing in. It also makes their job more meaningful too, to know how the support they're able to provide is helping you and what your vision is for the future. And then we've had these various regional development workshops. I just mentioned the one that Muhas hosted in May. We have panels at CUGH this year. It's going to be in Los Angeles. The year after, I think it goes back to Washington, D.C. We've done joint publications on mentorship, and we share resources across various programs. And the fellows in a particular country or region will oftentimes work with each other professionally and also get together personally. They'll meet each other at the orientation. So you know the deadline, you know our website, and you probably have Kimberly's email memorized by now. So I think that's it for me. I'll stop sharing. And we're going to take questions after Nathan Brandt gives his presentation. I assume Nathan's on.
Yeah. Do you want me to give it now?
Yeah, go ahead.
Perfect. All right. Hey, everybody. I'm Nathan. I'm a fourth-year general surgery resident at University of California, San Francisco, and a recent graduate of the GloCal Health Fellowship. So I'm going to kind of quickly give a presentation that's a little taste of the research that I did, and then more generally kind of what my GloCal year looked like and how it fit into my greater career plans. So first, a little bit about me. Born in Minneapolis, went to school Colorado, and a medical school Columbia. During medical school, I was fortunate enough to work in Nairobi for a year, working with the Kenyan Ministry of Health and helping them on their national cancer control strategy. And that kind of started my interest in global oncology and helped introduce me to my mentors, who later became my primary mentors for my GloCal Health Fellowship. Currently, as I mentioned, I'm a surgery resident at UCSF, and from 2022 to 2023, I was on my GloCal living in Dar es Salaam, Tanzania. So briefly, just for those who aren't surgery residents, the way that our training works is it's a 7-year residency with 5 clinical years and 2 years of protected research. For us, the protected research happens after the 3rd clinical year, and that's during that protected research time was when I did my GloCal. So this is kind of more pertinent for surgical residents who may be on the Zoom, but the way that I structured my research time is my first year I spent in San Francisco, funded by Surgical Oncology T32, working in a basic science lab. And the second year was funded by the GloCal Health Fellowship, where I was living in Dar es Salaam, Tanzania. So I was hosted for my GloCal at Muhimbili University of Health and Allied Sciences, which is located in Dar es Salaam. It's the largest health sciences university in the country and conducts most of its clinical care at Muhimbili National Hospital, which is the largest national hospital in the country, which is also located in Dar es Salaam. I created a mentor team with Dr. Larry Akoko as my local mentor. I met Dr. Akoko while living in Kenya initially, though he was visiting from Tanzania, where he's based. He's a surgical oncologist and an associate professor of surgery at Muhimbili University of Health and Allied Sciences. Locally, I was mentored by Dr. Daru Gazgadis, who's a pediatric surgeon with vast experience in supporting surgical initiatives in Uganda, and is the director of our Center for Health Equity in Surgery and Anesthesia. And then my trans mentor was Dr. Cameron Gaskill, who's a surgical oncologist at UC Davis and had actually conducted a study in Ghana during his research time as a surgical resident that kind of formed a foundation of the research project that I wanted to complete in Tanzania. So it was a very nice kind of full circle for him to be able to mentor on how to complete this study. So the problem statement that really started with my project is the fact that no systemic assessment of surgical oncology services have been done in Tanzania at the national level, and little is known about the geographic trends and capacity of and access to surgical oncology care in the country. So a little bit of background just on the intersection of oncology and surgery, especially as it relates to low middle income countries. Globally, it is estimated that in 2020, there were 19.3 million new cancer cases and 10 million cancer-related deaths. And in Africa specifically, the incidence of cancer is expected to double by 2040. Now, on a surgical side, globally, it's estimated that 5 billion people lack access to safe surgical care. So it's not necessarily surprising that in low-income settings, access to surgical oncology care is often very limited. In Tanzania specifically, there are over 40,000 new cancer diagnoses that are made each year. The treatment of cancer is primarily centralized in a few specific centers. That's Ocean Road Cancer Institute, which is located in Dar es Salaam, Kilimanjaro Christian Medical Center, which is up in Moshi, Bugando Medical Center in Mwanza, and then Benjamin Mkapa Hospital in Dodoma. There are a few other private hospitals that offer chemotherapy, but most of the surgical care, which for cancer, best case scenario is done on an elective basis, though obviously there are some surgical emergencies caused by cancer. Primarily, the elective surgical care is done at the zonal referral hospitals and the national referral hospitals. The zonal referral hospitals in Tanzania are Mbeya Referral Hospital down in Mbeya, Benjamin Mkapa Hospital in Dodoma, Bugando Medical Center in Mwanza, Kilimanjaro Christian Medical Center in Moshi, and then in Zanzibar, Mzee Moja Hospital. And then the National Referral Hospital, which is Muhimbili National Hospital. So in order to study the general case volume of surgical oncology care in the country, what we did was we reviewed operative case logs from each of these hospitals, as well as a convenient sampling of the smaller regional referral hospitals. So every time anybody goes to the operating room, after the case, the surgeon has to write in the case log a little bit of data about what the day did. So it's usually the date, the name of the patient, the age of the patient, and then the post-operative diagnosis. So going through this, we reviewed all of the case logs for the year of 2022 at all of these different hospitals and then 3 regional hospitals to get a sense of how much surgical oncology and how much cancer surgery is being done in the country. So this is just a map of where we ended up being able to visit. In total, we were able to access the surgical case logs at 10 different hospitals. That is the 5 regional hospitals that I mentioned: Mbeya, Benjamin Mkapa, Bugando, Kilimanjaro Christian Medical Center, and Mzee Moja, as well as the 2 national referral hospitals, which is Muhimbili Orthopedic Institute and Muhimbili National Hospital, and then 3 regional referral hospitals: Tanga Regional Referral Hospital, Dodoma Regional Referral Hospital, and Sekottore Regional Referral Hospital in Mwanza. In total, we felt that we got almost all of the very busy public hospitals in the country. There was one very busy regional referral hospital in Arusha that we were not able to include. But other than that, we were able to get access to everything. In total, we reviewed over 69,000 different cases or operations that occurred during 2022. And from that, we abstracted 4,248 cancer surgeries that occurred during that year. So this is a terribly busy table, but essentially what I want to highlight for you guys, and this is just, again, a taste of the data, this isn't necessarily a scientific presentation, is the fact that only 42% of all of the cancer surgeries that happened in Tanzania were for treatment intent. The rest of the 58% were either for palliation or diagnosis. And also, while some of the common sites that received cancer surgeries, such as breast, the majority of them were for treatment intent, primarily mastectomies. Other very common sites for cancer, such as prostate and esophageal, over 80% of all surgeries were done for palliative intent. So, kind of zooming out from just the data that we collected and kind of thinking of how GloCal Health fit into my career and why I'm kind of literally the poster boy for GloCal, seeing that they put me on the poster for the GloCal Health Fellowship, is GloCal really gave me an opportunity, and my first opportunity, to lead my own funded research project with multi-level mentorship. And I think this is really profound, that while trying to fund my research years, you find a lot of opportunities that will provide funding to fund you, but very few research fellowships give you funds to fund your actual scientific project and give you the opportunity for the first time to start leading and making decisions on how to spend money to move your research forward. And the GloCal Health Fellowship allowed you to do this in a very kind of supported way with multi-level mentorship that's both local mentors as well as mentors from your host institution, and a trans mentor that has a specific knowledge in what you're working on, which allows you to take risks, but also do it in a very supported way. As Dr. Cohen mentioned, their ongoing works in progress meetings, as well as their seminar series, where you get to hear from many GloCal Health Fellowship graduates that have gone on to do incredible things in both academia, the nonprofit world, and the private sector, really helps you figure out how you can leverage this experience for the next kind of career move. As well, this gives you a successful experience in obtaining an NIH grant, and is a nice stepping stone to future grants such as the K-43, which Dr. Cohen mentioned, some of the graduates receiving, which is really a way to build upon your academic career. And kind of in tying to the first point and the third point, in order to get these bigger grants, you oftentimes need preliminary data. And there's no better source of preliminary data than your GloCal Health Fellowship, which is a project that you run and you're in control of, and provides preliminary data that you can build upon for future grants. So with that, thank you guys for your attention. Here's my email. You can write it down now, or it's very simple. My name is Nathan Brand. It's just nathan.brand@ucsf.edu. Happy to answer any questions. I'm going to stop sharing.
Thank you, Nathan. That was great. I know Kimberly and I have been answering questions in the text. I'm sure hopefully it's available to everyone. So this is the time for you to ask questions. Helpful to you, or also you think would be helpful to others on this call too. I know we have a whole variety of people. We have, I'm sure we have US postdocs who are thinking or are planning to apply, medical students, professional students, PhD students, as well as our postdocs from around the world. So, chance to ask a question. If it's a question for you, it's probably also a question for others on this call too, since we have almost 60 people on this call. You can raise your hand. Okay, Agnes, go ahead. Unmute.
Hi, everybody. Good evening, good morning. And thank you very much for the wonderful presentation which you have shared us. Thank you, Greg, for giving us an overview, and thank you, Nathan, for giving us your experience. I am Agnes Kosia from Tanzania, and I'm very happy that Nathan really provided the good information for me as I wish to apply for this fellowship. I just wanted to ask that, is it necessary to come from Muhimbili to apply for this fellowship? Because I've tried several times, as I don't work from Muhimbili, but I'm living in Tanzania, but Muhimbili is too near to me. So I just want to know, do I really need to come from Muhimbili to apply for that, or even can apply apart from Muhimbili? Thank you.
So thank you, Agnes. Sorry, which institution are you affiliated with?
I am in a non-government organization, but I have studied it in Muhimbili.
Ah, okay. So you could apply, but you would need to identify a primary mentor at Muhimbili. Okay. And you could even continue, if you're doing work at your NGO, you could continue a project there with the mentorship through Muhimbili. The funds would flow through Muhimbili, not through your NGO. But we are looking for individuals who are thinking about a long-term academic career. Again, that could be in a nonprofit as long as there's research that's included in that. And then you would also need to identify a primary University of California mentor and then the trans mentor that I mentioned earlier.
Thank you very much. That was very useful indeed. Thank you.
Caroline, you're next.
Okay, thank you very much for the nice briefing and the nice experience shared by Nathan on the experience with the GloCal. So I have a question. I'm Caroline Damian from Tanzania again. Of course, I have seen the application from the website that at least you need to have a primary mentor from Muhimbili. And I know that Henry Sawe is from Muhimbili, one of the a mentor for the GloCal. So I just want to ask for the other mentors, of which if you are applying for a specific specialty to work on, is there any specific criterion for the selection of other mentors of which need an approval? Or if I think I just want to research on a certain specialty, then I have to find a mentor who is expertise on that specific specialty. Is there a criteria from your side? Thank you.
There's no, yeah, they just need, so if the University of California mentor, they just need to be a faculty member who agrees to be your mentor at the University of California, any of our 10 campuses.
Okay.
Now, there are probably 30,000 faculty at the University of California, or maybe even more. So your challenge, of course, is how do you find that one person that's going to be the best fit for you, that agrees to be your mentor, that ideally has, well, they definitely need to have expertise in your area of research, and perhaps they already have connections with Muhimbili or in Tanzania, right? And there we have a list on our GloCal website of people that previously, as we submitted the grant 2.5, 3 years ago, they agreed to say, okay, I'll serve as a mentor. Potentially, I'll serve as a mentor for the fellows in the program over the next 5 years. So you can look at that list. And then I've been fielding questions along with Kimberly. I'm going to show you, I'm going to share my screen for a moment. This will hopefully benefit everybody.
Okay.
Okay, so there's, hold on. Gotta get back to, okay. Okay, this is called profiles. Do you see this? If you put in UCSF and profiles in Google, you'll get to this website.
Okay.
So look at here. So Carolyn, what's your area of research interest?
Yeah, actually, I'm a
Give me 3 keywords right now. I'm not asking anything specific. 3 keywords for your research.
Management of labor.
Okay, I'll just put
something
I'll put obstetrics.
Yes.
Okay, I'm not
sorry.
Okay, management labor. What else?
Labor monitoring.
Labor monitoring. That's going to be a little hard. Maternal fetal medicine.
Okay, fine. Yeah,
I'm
okay.
just, and I'll put global health.
Yeah.
Because you're like for somebody who's doing the high-tech stuff in San Francisco, you're looking for somebody who's going to understand. I mean, I already know people that work in this area, for example. Okay, then you hit search. Is it working? Oh, there it is. Okay, so look.
Oh.
And then you click on Mary Norton. Let's see. I think Stephanie Gaw would be better, actually. Okay, so here's her nice picture. And then it tells you where she went to school, all that. Here's an overview of her research. Okay. Here's her interest. You see global health marked there. I know that she's also served as a GloCal mentor as well. I happen to know. Here's her publications and everything, right? Then her contact is here as well. Download the V card. anyway, I'm not going to get into all this. But so most of our campuses have profile. Unfortunately, we don't have one of those. It'd be lovely to have a profiles for the entire University of California. We don't have that. So you would have to look at UCLA and UC San Diego, the other campuses that do have profiles and do that independently for each of those campuses. I happen to know that in Tanzania, as you know, each institution in the 21 institutions we partner with usually have one UC campus, which is their strongest link. That makes sense. So for example, Universidad Mundial, I forget what the E is, in Mozambique is most closely affiliated with UC San Diego historically. Although there are also connections with San Francisco and also with LA. For example. Or with MUHAS, the closest collaboration historically has been with UCSF, right? The Haile DeBoss Educational Building. For example, he's our Chancellor Emeritus at UCSF and helped to create a strong partnership between our two institutions. So I know that I would probably look at UCSF. You can look beyond if you don't find the person with the right expertise at UCSF. I certainly would look at campuses if it's a niche area, if that makes sense.
Okay, yeah, it makes. Thank you very much. I will keep in touch with Kimberly and
you can also email me as well, like in your area, especially obstetrics. I know the people. If you you can also talk with your mentor at MUHAS, Mumbili. Do they know someone as well?
Okay, thank you very much. Thank you.
All right. Another question. Anybody have another question? Raise your hand. I see a question here on ethical approval. You need to get ethical approval from your host institution and then your UC campus that you're most closely connected with.
Thank you so much.
Yeah, and that's before collecting any data and everything. We really like it when because this process can take a very long time. We really like it. It's like not right after you've applied, but if you start getting some positive words from us, like you're accepted, that would be a very positive word, or even like high up on our waiting list, to really start working with your mentors to put together the protocol and all the IRB materials to get that going. Because some people are pushed all the way until January or February of their fellowship year before they can actually start data collection, which can obviously be challenging. Oh, I didn't mention the benefits of the program. So we do cover a stipend for everyone at the NIH levels. And then we have a negotiated rate with each country. It's different in each country, but it's based on what the postdocs earn at your institution. And then we give you up to $15,000 to conduct research. And that's for everyone. If you're a medical student, you get $15,000. If you're a postdoc, you get $15,000. And then we also give you funds for education. So again, to do the online courses, and then for travel, and then also we cover you during your week-long orientation as well. Timeline. Okay, I see that from Milan. So the timeline is November 1st, submit applications. Usually we get the written reviews. This is all internal. You'll hear back from us either the very end of January or early February. If you're accepted, waitlisted, again, waitlist is not a bad thing, or rejected by early February is what you'll hear from us there. Acceptances, if you're on the wait list, can happen this year. We had somebody accepted, I think even into July. It was one of the additional institutes that decided to fund one of our fellows in Uganda. And he was able to make that, to accept that award. So he's a fellow this year. So I think that, I don't know, Milan, if I answered your timeline question, I'm not sure. I assume it was around the application process and acceptance and things like that. I know that many people are applying for multiple awards or multiple opportunities for postdocs, for example. So we really try to get the word to individuals as quickly as possible. And to be honest, especially the US postdocs, because you have this kind of strict timeline of kind of this academic year, we try to let you know as soon as possible. Even some people we're able to let them know even before February, even sometimes in December, if they're top candidates. So that's up to you to put together your best application possible. I see Michael's question. That it's really what you want. I mean, it's your career. So the research should fit into whatever you see your next step being. We're trying to support you to eventually become an independent researcher. So wherever you might have done something in your dissertation that you're going to use, you want to go in a slightly different direction, or maybe even a completely different direction. I mentioned the soil microbiologist also has a background in geography from UC Davis that I mentored 2 years ago in Kenya, Mariah Coley. So she ended up studying the soil microbiome and gut microbiome of children affected by chronic diarrhea, and looking at the associations between the soil and the gut microbiome, and then also how precipitation may affect that relationship as well. So again, you can use GloCal however you want, but it should be funding the area that you plan on. You know, the idea, not everyone doesn't apply for a career development award, a K grant. I mentioned the K43. There are similar grants for US postdocs and junior faculty as well. But we are looking, ideally, you're developing the pilot data, which you would need to submit for that next grant, whether it's a career development award or whether it's an R21 grant or whether it's a foundation grant, whatever it may be. We're looking to support you to get to your next professional step. So we have just a few more minutes. If there are any other questions. Again, I want to encourage you to reach out if you want to get the fellow's perspective. Nathan, thank you. You can reach out to Nathan. Of course, all of you are in touch with Kimberly. And then if you need help in identifying mentors, or you want to share like some specific games with me or any of the MPIs, you please make use of us. How many applications get accepted? So this year we have 18. We had a little over 40 applications submitted.
Hello, Craig.
Yeah, go ahead.
Yeah, I'm Dr. Vivekanand from India.
Welcome.
Yeah, so I'm working as a urologist here. Yeah, so the first step is to just how to approach, like first to apply. Should we go for application first, or just start with searching our faculty, mentors?
Well, in order to apply, you have to have at least 2 letters of support, one from your mentor, in your case from St. John's Research Institute, and then also you need a letter of support from your mentor at the UC campus you plan to work with. And you not just ideally, but you really have to work with your mentors in order to put together the strongest application possible.
Okay.
So you should identify those, you should already have identified them. If you haven't, you should identify them as soon as possible. If not, you should plan to apply next year, probably.
Fine.
Okay.
There are urologists in this one, faculty mentors in the list, I think, no? There are urologists.
Yeah, you'll have to be honest, I don't have there's like 220 people on our list, so I don't have them all memorized. So you would have to look, and you could use the profiles function that I showed you, and many of our campuses have profiles.
Fine.
Yeah.
Sure. Thank you.
Any other questions from anybody? Okay, so I want to thank Kimberly Bale for pulling this all together. I also want to thank some of you have been interacting with Christine Joy Abella, who's been our assistant coordinator. I want to thank her. She's actually going to be leaving us shortly to start her master's in public health at UCLA. So if any of you are affiliated with UCLA, she'll be down there shortly, or you're probably already down there because classes must be starting today. since the quarter is starting today as well. Again, please reach out to us. We're here to support you in your as you put together your applications, to answer your questions. And I see this question here around, really, Jay, there's no real great way to answer your question. Put together your best. We really want to see excellent and outstanding applications. If you put in an outstanding application, you're going to get funded no matter where you're from. So do your best in putting together your best application. That's my word of advice there. All right. All right. Thanks, everybody. Bye-bye.